the biggest thing that a fraud examiner has to understand is, has fraud been committed? You have fraud, waste, and abuse, and that line is so closely related. And I think you really have to have a good understanding that fraud is the intentional misrepresentation of a claim to Medicare or Medicaid, and make sure that you don't confuse waste and abuse. Now, under Medicare and Medicaid, sometimes waste and abuse will get you the same fines and sanctions as if it was fraud. Make sure that you understand what fraud you believe has taken place. Instead of making an assumption, go into it that there could be fraud. I think the second thing, that anyone that is participating or in any type of fraud investigation around healthcare, they need to understand the language in healthcare, as well as have at least a basic knowledge of medical coding. Because if you're going to interview potential witnesses, they're going to use terms and words, and it's going to be very easy for you to be confused if you don't at least have that basic knowledge to have a conversation with them. And then I think third, you need to have access to data. Data will help you determine whether or not you see any outliers, any individuals that are outside of their peer segmentation, as well as you may want to request charts to confirm that fraud has actually taken place. Well, one of the biggest things that CMS is doing right now is they have contracted with Northrop Grumman for a predictive modeling tool. That's going to really help them leaps and bounds, because algorithms will be built to help them identify fraud quickly. So before they make payments, they'll have an opportunity to deny payments because of the potential of fraud. The other thing, education. There needs to be a lot of education so that you are aware of the fines, the sanctions, things that can happen to you as a provider for participating in any fraudulent type of behavior, and also understanding that whatever your staff does, you can be equally responsible. Well, one of the things that most private insurers have, or if they don't, they should have, is coding software. Coding software helps with a lot of fraud. It helps you with unbundling. It helps you if someone is trying to bill for services that should be covered under like a 90-day, after someone's had surgery for the first 90 days, you know, certain things are covered within that 90-day look-back period. So I think coding software is one of the biggest things that I could say make a difference with your fraudulent research, as well as SIU departments. Most insurance carriers have your SIU departments, which work with external vendors and sometimes internal processes as well, where they look for patterns and they look for outliers in order to go and see if fraud has actually occurred. I'd want to say that most of your insurance carriers would have compliance programs in place that yearly employees would be expected to take an exam and read information. So I think people are aware and knowledgeable, but maybe it's just having more huddles, more FAQs throughout the year. Once a year is great, but now with the fraud that exists, it may be just where once a year is just not enough. What happens a lot of time is everybody just gets busy, and we don't seriously take the consequences for fraud, waste, and abuse. I do think the government is doing a lot more oversight of who can join the Medicare and Medicaid networks, and I think that's going to help, but it doesn't help the providers that are already in the network that are billing fraudulently today. The more data sharing that you have, for example, let's say you have a doctor in one city and they send a patient for x-rays. If the next doctor that the member went to maybe 2 days later, because the problem has come back, if he could see the results that, hey, this doctor just did these x-rays, I don't have to repeat these x-rays, maybe that will help with cost. It'll definitely help with understanding if providers are being consistent in care, as well as are there some fraudulent patterns being created, as you can see what the other providers have been doing for the care of this particular patient.